So think of this section more like bonus content, things that I didn't get to cover, other topics that just didn't really fit in, such as expanders, dealing with injuries, and misconceptions and scams. That's what we're covering in this section. So for expanders, what's an expander? These are palatal devices, orthodontic devices that are designed to widen the upper jaw gradually by applying pressure on the two halves. They look something like this in very common form, the palatal expander being the silver thing over here, and the upper jaw being split in the very half. And it puts pressure that stimulates bone growth between the halves. Usually you'll see this in children where it's kind of linked up to the teeth, but with adults it's actually like set in with nail. It's really weird, screwed actually. And there's a whole lot more screws, but this is the simplest form of a palatal expander. And essentially the patient or the guardian, if they're a kid, turns the screw located at the very center of the device daily using a specialized key, and as a result it incrementally increases the outward pressure, facilitating the expansion over time. It takes a bit of time, and eventually you will have a bit of a gap here, but you know, if they have baby teeth, you know, that obviously gets solved, and you have dental care and braces to solve it. And because the bone is also soft, the time it takes for that gap to close is actually sooner than later. So even for adults, that's nice. But do you need an expander, right? Deciding whether or not you need this requires an assessment by an orthodontist. However, indications are going to be things like crossbite, teeth overcrowding, breathing difficulties, or challenges with mewing. So if you're not able to mew and breathe through your nose, likely you have a narrow palate. I would say even an average palate, because you can still get it down if you're not able to breathe, but there is a correlation with that of a narrow palate and not being able to mew properly, because your tongue won't fit, and as a result it's taking up more vertical space. So if these issues are present, it's advisable to consult with an orthodontist, okay? Don't just come up with your own treatment option. And pros and cons for an expander is going to be, first off, it corrects crossbites, enhances facial symmetry, prevents future orthodontic issues, and improves nasal airway breathing. An issue with this is going to be this potential, actually very likely, gap in the front teeth, mild pain and pressure during adjustments, and initial challenges with speaking or eating. Now I want you to understand that an expander is going to cost quite a lot, especially in the US, about $2,000 to $3,500, which, you know, according to your net worth or the money that you're reeling in, may or may not be a lot. But they do carry additional expenses like braces in the US especially. But yeah, depending on where you live, it'll cost and it'll vary, especially if you're an adult or if you're a kid. If you're an adult, there's more to it, and I really don't recommend going down this path if you're an adult, unless you have a very, very narrow palate and you really want to fix it and you're all about breathing healthy. It's not just about how you look at that point, it's more about like your health, okay? So if your health is at risk here, then definitely go for this. Go to an orthodontist. You won't lose anything from doing that. So as for injuries such as TMJ and bruxism, we're going to start with the common list of injuries, being that of lip and cheek biting. You know, this happens sometimes when we're accidentally chewing something. You know, it's a minor injury, okay? It's going to give you discomfort and it will affect your normal chewing function. And the best thing to do is to get your teeth fully aligned if they're not. If your teeth are fully aligned, it's less likely to happen. So to test this out, make sure your jaw is ever so slightly open so that your cheek can't slip through in between your teeth when you're chewing. So just never clench all the way down, and you should make that like a practice in general. No matter how straight your teeth are, you don't want to be biting down completely when you're chewing. And then clicking or popping in the jaw. Clicking and popping in the jaw is going to be that of a TMJ issue, like it's a signal for that. So it's going to be accompanied with some pain when chewing. And the way to go about this is to chew less harder foods, as well as applying stretches and exercises that I'll be covering later on. And then jaw pain while eating. If you're experiencing pain while you're eating, the main common is going to be because of various issues. It could be muscle strain, joint problems, dental issues. You can never really know because jaw pain is it's a very vague approach. But the solution is going to be, simply put, avoiding chewing hard food, of course. This is not really a solution, more like a preventative measure to not make it worse. And then if it gets even worse or you're still experiencing that pain, go to a doctor. You need consultation at that point. There's no DIY home remedy for something like that. And then tooth injuries, things like chipped or cracked teeth, can happen genetically as a result of just like weak tooth structure, or you're malnutritious in some way, and it's going to occur while you're eating hard objects or food items. So really stay away from hard foods like that if you know yourself. Go to a dentist if you're experiencing that of a chipped or cracked tooth. He'll reconstruct them for you easily. Just don't rely on that consistently, because you don't want to have a bunch of chipped teeth that are relying on your dentist's glue. It's just really not the way to go, plus it's very expensive. And then muscle strain, overexertion or misuse of jaw muscles, often associated with excessive gum chewing or jaw clenching. This is likely going to happen if you're following our jaw width guide the wrong way, so please go follow it to the T. This can result in discomfort and difficulty in chewing. So how can you go about that? Again, staying away from hard foods and starting again after 2 weeks after the strain has gone away completely. And I want you to start with low volume and don't push till failure. This is not going to happen, okay? I know in the jaw width guide we spoke about pushing till failure, but you won't do this if you're experiencing muscle strain. Like, I'm talking real muscle strain. TMJ is, as I said, this issue of clicking. It's one of the things, but it's important to know the common causes and the ways to prevent it. Number one is teeth grinding. If you don't know what that is, it's bruxism. It's when you're clenching and grinding your teeth, especially during your sleep. This can strain in the TMJ and surrounding muscles, leading to more issues with it. Now, when it comes to jaw stress, a lot of stress can get you to clench your jaw muscles, which will also increase this risk because you're just clenching for no reason. As much as we covered chewing excessively in the jaw width guide, growing your masseter muscles, chewing gum excessively is going to do the opposite. It's going to overwork your jaw muscles and potentially contribute to TMJ discomfort. It's not worth it. It's more likely to happen, especially if you're chewing hard stuff and if you're pushing till failure with the jaw exercisers. So please stick to the time limits that I've given you guys. That's going to keep you in check. And of course, everyone's different, so work with what does best for your jaw. And then jaw trauma, facial injuries or accidents. We covered this a little bit. Things like boxing or martial arts is going to mess you up really badly. So wear headgear, okay? This is a protective measure, as well as limiting gum chewing as well, the time. Stop being aggressive with it. Do it in moderation. And then relax your jaw muscles. Stop being stressed out. Find a way, make an effort to relax your jaw muscles consciously, okay? And if you're still experiencing pain, clicking, difficulty with jaw movement, consult a dentist or even a maxillofacial specialist for proper diagnosis, okay? It's very, very important. This is about your health here, okay? Not the way you look. And then bruxism. We spoke a bit about this. It's tied with TMJ a little bit, but it's got a lot of impacts. It's really the result of stress and anxiety. I've covered it here in the causes. You can see it's one of the main things, but it's going to give you teeth damage, flattened, fractured, chipped teeth, erosion of tooth enamel, revealing the inner tooth, increased tooth sensitivity. So if you're feeling all of these, you're likely going to have a bruxism, a state of bruxism. And then jaw muscles. Continuous grinding can actually lead to the hypertrophy of jaw muscles, including the temporalis, the masseter, the medial, I don't even know what that is. It's all potential for TMJ disorders. And swelling and enlargement of the muscles can actually alter your facial appearance. So a lot of people that have bruxism actually have this issue. And then bone health. It's going to lead to this periodontal disease, most likely characterized by bone loss and gum recession. Gum recession is bad as it is, and you don't want that, which actually will affect your gum health. And once the bone is lost and it doesn't regenerate, it will make it a chronic condition. It just won't go away. So please make sure you don't have this. The likely causes for you to avoid, to make sure you're not having this, is first off stress and anxiety. Make sure you're working to kind of mitigate your stress levels. This tension can lead to this teeth grinding that occurs in your sleep. And if you have sleep apnea, you're more likely to have bruxism. Oftentimes, the most common reason people have bruxism. Misaligned teeth is likely to be caused by bruxism. If you're on medications, things like antidepressants like SSRIs. The solution are going to be oral devices. They're custom fitted mouth guards to help you protect your teeth from sleeping. These are going to be prescribed to you. Sleeping position, sleeping on your back, reduce the likelihood of teeth grinding compared to sleeping on your stomach. Limit stimulants like caffeine. Okay, if you already have bruxism, this is going to help you avoid alcohol, tobacco. It's going to help you alleviate these symptoms. Regular dental checkups. Go to your dentist. Okay. Oral muscle relaxants. In some cases, they'll actually put Botox treatments along with medications to help you with your bruxism. So that's another way to go about it. This will be a natural way to reduce the muscle size. And yeah, at the end of the day, you need to seek professional help and diagnosis if you're experiencing jaw pain, as I said, or even headaches, unusual wear on your teeth. Check out your teeth, see how they look in the mirror. And they're going to recommend you appropriate treatments and preventative measures tailored to your specific needs in the way that this guide can't. So yeah, that covers injuries. Now, as for misconceptions and scams, a quick introduction. There's going to be so many misconceptions out there, scams, even snake oils associated with the means of, beauty industry in both men and female sections. And so we're going to debunk a couple of these bad products and scams, starting with the most common ones. The first being gua sha and jade rollers. These are often promoted for draining lymphatic fluid in the face, okay? That's all it's going to do for you. The effects are minimal, they're short-lived, they last around 20 minutes at most. And while they do feel good for massages, don't expect significant facial definitions or jaw growth or long-term effects. Many creators actually exaggerate the results of these techniques using lighting, angles, cheek biting, and makeup to even sell products to you, often dropshipped from China. I know a lot of people that do this, it's crazy. The material of the gua sha doesn't even affect its effectiveness, so opting for cheaper options on Amazon is usually most cost effective, so you don't even need to get the stainless steel one, it doesn't matter. Expensive gua shas mainly benefit the business owner and not you. Now, facial exercises, what are they going to do for you? Nothing. They don't work, almost never. Are they reasonable and time effective? Absolutely not. You can make as many kissy faces, they will not bring you significant results. We're talking about the jaw, weird kissy faces exercises that you're seeing on social media. The opening your mouth extremely wide and closing it. The only way this works, I would say, is improving the hyoid bone, and that's not really a jaw exercise or face exercise, it's more like a neck exercise. So I will be covering that. But apart from that, they actually can make you look worse, and some even actually being straight up dangerous, okay? They're gonna give you wrinkles and make you look retarded, right? You don't wanna look like that.